Thank you for joining us here today. We're joined by Dr. Rachel Herlihy, our state communicable disease epidemiologist, Scott Bookman, our incident commander, has been working extremely long hours, Dr. Eric France, our chief medical officer, Mike Willis, our director of emergency operations, Kevin Klein, a director of Division of Homeland Security for Emergency, Stan Hilke, director of public safety. We have Denver Mayor Michael Hancock available for questions, Bob McDonald, head of Denver Public Health, and Lieutenant Governor Diane Primavera, and some others. As I said on Wednesday, this is going to get worse before it gets better. This morning, we're up to 72 positive cases in Colorado. Out of those, at least 4 are evidence of community spread in the metro area. We've already confirmed evidence of community spread in a number of resort communities in the high country. And at this point, we can confirm evidence of community spread in the Denver metropolitan area as well. Again, none of this should be surprising. We said that this was likely a few days ago. This has been confirmed by the information for our testing and others. Of the 72 confirmed cases, 8 people are currently hospitalized in our state. 3 of those are in critical condition. And of course, again, we want to make sure everybody is prepared and aware. We have seen other areas that are 2 or 3 weeks or a week ahead of where we are on the contagion. It is just a matter of time till we do have our first fatality here in Colorado, and that will be reported on. Again, within the context of course, the difference in fatality rates across different age groups. Very low incidence among the young and significantly higher in 70s and 80s. In fact, in Washington State, 17 of the fatalities were over 70 in one nursing home facility. So when we're talking about some of the steps we're taking to protect our most vulnerable, that will save lives. We are keeping the cases of the 8 people who are hospitalized in our thoughts, in our prayers. We know that our medical professionals are providing the very best care. The good news is about over 90% of the people we've tested have tested negative for coronavirus. They merely have a cold or flu. That means that if you have a cold or flu, while you should stay out of circulation and not go to work and avoid contact with others, it is still more likely than not that you experience a cold or flu as opposed to coronavirus. There are likely thousands of cases in Colorado that have not yet been tested or whose tests are pending again. So I want to move the focus a little bit away from the 72 confirmed positive cases, because in all likelihood there are hundreds, most likely thousands, of Coloradans who have coronavirus who either have pending tests or have not been tested. But as we've stated over and over 80% of the cases are mild, where symptoms are, if needed, treatable with over-the-counter medication. It's the 20% of cases, mostly older Coloradans, people with underlying health issues, that we are most worried about. Not only because these cases are severe and could even be fatal, but because of the strain that these cases will put on our public health care capacity and resources, as we have seen in other areas. I want to urge my fellow Coloradans in these challenging times to keep a perspective, but also take personal responsibility to do your part to stop the spread of COVID-19 coronavirus. And I know that many of you feel a lot of anxiety, fear, and lack of control, as all of us do. I'm urging Coloradans to focus on what we can control. What's in our control is how we can be part of the solution. The simple things that you've probably heard, but you need to make sure that you actually do in your own lives. And that means washing your hands with soap often for 20 seconds. It means not shaking hands with others. It means staying home if you're sick. And of course, it means taking steps to protect those who are over 60, particularly over 70 and 80, as well as those with chronic illness that put them at risk. It might mean things like offering to deliver groceries to the doorstep of an elderly neighbor and pick them up for them so that they don't need to go out. If you have flu-like symptoms, again, we encourage getting tested and, of course, avoiding others during that period. As I've stated before, this is really an all-hands-on-deck effort to slow the spread in Colorado and to support our fellow Coloradans who are in need during this trying time. We're bringing the full weight of state government. We're partnering with local governments. I want to thank Mayor Hancock for his friendship and partnership throughout this and his clear-eyed leadership for Denver and, of course, at Denver International Airport. We're also joined by Bob McDonald for Denver County Public Health, who's been working closely with us. Really, I've been humbled by the great outpouring of Coloradans as well as corporate partners for their proactive support, their generous offers to be of help at this time of need. Today, I'm announcing we're standing up a statewide effort to harness many of these efforts to help. Rick Sapkin and Roxanne White will co-chair the effort to coordinate the officer support from the private sector, philanthropy, and nonprofits in conjunction with our fiscal sponsor, the Mile High United Way. So there'll be more details on that effort, but that is underway to harbor some of that great goodwill in the private sector and philanthropic sector to help support those who are most in need. My Deputy Chief of Staff, Danielle Oliveto, will be the liaison for the Governor's Office to this partnership. Next week, in conjunction with Mile High United Way, we'll launch the website and more information on how to get involved and support your fellow Coloradans as well as our state response. To date, my administration has been focused on expanding testing capacity with the goal of identifying those who are COVID-19 positive and isolating them to the extent possible to protect our most vulnerable Coloradans. We are focused on expanding testing because early detection means early treatment if needed, which is better for the patient. Early detection informs healthy patients that they need to isolate themselves to prevent the spread to others, right? If you have the cold, you might think that you're back in circulation after 2 or 3 days after the symptoms subside. If you test positive for coronavirus, even though you're feeling fine, you need to stay out of circulation for up to 2 weeks. It's 10 days to 2 weeks. We're recommending 2 weeks at this point. The testing also informs our public health officials and policymakers on where we need to focus our resources. We are, as I mentioned Wednesday, very much on the verge of a tipping point. We are seeing limited community spread, and that's what the science available today tells us. While our current scientific understanding is that we have limited community transmission, we fully expect and are actively planning for that community transmission to accelerate in the coming days and weeks ahead. As we move into a new phase of community spread, we want to continue to push the federal government as well as the private sector partners to scale up testing. Aggressive and sustained testing is a powerful tool for fighting the virus. To date, our administration has completed test results for about 600 Coloradans, over 650 Coloradans. This week, our drive-up testing lab collected samples for 650 more people just in the Denver area that our experts are providing support for now. We expect those full test results soon. Because of these swift and bold actions, we've been able to test at a far faster rate than the rest of the nation. Yesterday, the CDC announced that 11,000 Americans have been tested. That's in a country of 329 million people. At CDPHE, we've collected tests for more than 1,500 people in a state of 5.7 million people, a much higher rate than that federal rate. In fact, more than 10% of the Americans tested are in Colorado, and we are a leader in testing. Now, that's relative to the rest of the nation, but it is far from enough here in Colorado and nationally. I want to thank everybody involved with this Colorado effort and leadership role, especially Scott Bookman, who stood up the first in the nation mobile lab in record time, and all the professionals working at the Lowry drive-up testing facility and the state lab who are working around the clock to administer and process these tests. Thank you, Scott. Where'd Scott go? Thank you, Scott. And by the way, it's an outdoor testing facility. They can't operate in inclement weather. We gave that in the press release yesterday. So they are not opening today outside. The protection gear is not safe with precipitation. They will be there tomorrow, weather permitting. And of course, in the future, we're going to work around what we can do around inclement weather. But we have to take the safety of our personnel first, and their protective gear is not rated for precipitation, and that's an important step. I wanted to say that the drive-up facility has collected tests from more than 650 Coloradans since Tuesday, far more than expected. The results of these tests are going to give our state critical intelligence that, and we have some of it in already, 80 or 100 in of the 650, that's incredibly important to inform our public health experts, our elected officials, our medical community on the action and timing of those actions. By standing up the mobile lab and collecting 650 samples, the state epidemiologists are able to get a much more informed picture of the extent of community spread and where we are in the epidemiological curve. I also want to applaud Pitkin County for standing up a mobile testing lab as well. That's operational today. Our state continues to work to open up additional testing sites, but in order to get the mass testing we need our medical providers to continue to come online with drive-through testing facilities and off-site testing facilities. The state cannot do this alone, and that's why I want to thank UC Health, Children's, Centura, Kaiser Permanente, and community health centers, including Stride, for the work that they're doing to collect samples. Now, those samples are sent out to LabCorp or Quest, and they're generally processed in 2 or 3 days. There are a number of sites across the state that are collecting samples, and that's important for 2 reasons. It's important for us to gain a better epidemiological picture on the spread statewide. It is also important for the patients to know. Again, it's not necessarily clinically important, because if they're having trouble breathing, they need to go in for treatment. Otherwise, you simply remain in your home. But it's important because many of them want to know, can I get back to work in 3 or 4 days, or do I have to isolate for 14 days in my home, right? If it comes back positive, you need to remain there the full 14 days. Comes back negative, when you get over your cold symptoms, you can return to work. While that result is pending, you need to stay isolated, right? Again, of the tests we've done, roughly 1 in 10 have coronavirus. The other 9 in 10 have cold or seasonal flu. But that is a real chance that those minor symptoms could be coronavirus, just as they could be the flu or the cold. So while you are waiting for those results, you need to isolate. They're negative, you can get back to work in 3 or 4 days. They're positive, you need to wait 10 to 14 days. At this point, the guidance is 14 days. That could be changed to the 10 to 14 day range, but we know that it's not easy, but you need to you remain in your home because of our desperate need to protect our most vulnerable, right? The fact that your symptoms are minor and you've overcome them doesn't mean that this wouldn't be devastating if it gets into a nursing home or senior care facility, or if your elderly uncle or aunt or grandparent catches it. I also want to applaud Pitkin County, as I mentioned, for their mobile lab, as well as our private testing partners. We need to dramatically increase our testing capacity. Frankly, we needed to dramatically increase our testing capacity months ago. I've personally shared this frustration with the Vice President. The truth is that the lack of early action out of Washington to ensure the availability of mass testing has hampered our ability to avoid mass disruption to our lives and economy, as well as put the health of many of our most vulnerable at higher risk. But we can't dwell on what happened a month or 2 ago. This isn't political. We need to focus on moving forward, and we need all hands on deck. We need to bring the full weight of our healthcare system to bear: federal, state, public, private, nonprofits, everybody. This will be an enormous strain on our systems and our workforce. I'm particularly concerned about the strains it puts on our healthcare workers, who are already being put to the test. In order to scale up our healthcare workforce capacity, this is a new executive action today under the Emergency Authority. I've asked the Colorado Department of Regulatory Agencies to cut through the red tape on licensing our medical professionals, so that medical professionals, including pharmaceutical, nurse, doctor, who are licensed in other states but residing here, can be immediately licensed in Colorado as quickly as possible to practice to address this shortage. So we are taking action to cut that red tape around reciprocal licensing to allow those who have licensure in another state but live here or moved here or even are visiting here for an extended stay will be able to practice here to meet that surge demand. That will be formalized in the next couple of days. We've also contracted to have dozens of nurses from out of state as well as within state arrive on Monday to help with our communities that have been hit the hardest. CDPHE has also authorized every EMT and paramedic in the state to administer the test. Again, that's another emergency action. That doesn't mean they all will at every site. Remember, they need to take the precautions themselves, but they are authorized to do so. Today, I'm also asking doctors and nurses who are not currently in the workforce. That means you're doing something else, or you're retired, you're in another field, but your license is active or can be reactivated. I'm asking you to reconnect with your past employer in the event that we need surge capacity. So if you have been a practicing nurse, RN until recently, or doctor, and are partially retired or in another field, please contact your prior employer to let them know that you might in fact be available. Part of the issue is, again, that as healthcare workers are diagnosed, they will be out of the workforce for 14 days. So we need to backfill those positions. That's why we've eased the licensure requirement with reciprocity, and we're encouraging people that aren't in the workforce but are qualified to consider temporarily re-entering the workforce. We are in close coordination with hospitals about management of their critical caseload and their elective caseload to best serve the public when our systems become strained. And again, that elective caseload is something that individuals are involved with too. If you're considering elective work, it might be a good idea to postpone that if there's not a need for that for your own health. This morning I reached out to Anschutz Medical School and asked them if they could also tap into their network of nursing and medical professional and pharmaceutical students, other graduate students, to help with this work. They are looking at additional ways to do that for students that might have more time because of the ability to doing the online. They've gone to online education. They have some flexibility to do some clinical work and testing work while they are doing that. As well as to reassign clinical work to meet the priorities of the state. Furthermore, we've activated the National Guard, and we have over a dozen medics in the National Guard that are getting trained up for providing additional testing capacity around the state and training other community medical providers on standing up their own mobile labs. So they are actually being trained today. And with the closure of the Lowry site due to the snow, they will be able to extend that training today of the Colorado National Guard, a dozen or more medics that will be able to do two things. Again, operate testing sites and also train others across the state, county health departments that want to stand them up to do so. Coloradans should continue to isolate if you have flu-like symptoms. And seek out testing at your provider. Again, most of those providers I mentioned are able to do testing with a 2 to 4 day turnaround. We're encouraging anybody who is symptomatic or thinks that you've been exposed to COVID-19 to call or email your physician first for guidance. If needed, obtain a doctor's order for testing and request information about what private providers are close to you that you can be tested at. But in the meantime, isolate yourself. Seek out emergency and medical attention if you need to, if you're having difficulty breathing or other severe symptoms. But the vast majority of people with coronavirus will not experience those severe symptoms and will not need medical attention. Always call first before reporting to a healthcare facility for testing to prevent infecting others at that facility. As we move into this phase of community transmission, it's important that we especially double down on our efforts to protect our vulnerable populations and work with the private sector to scale up testing as well as our response. We mentioned the other day, and we are issuing the final official orders today on nursing facilities to protect facilities that serve our seniors. I met with representatives from nursing homes the other day, making sure, again, that people who are healthy before they administer services, including contract services, to those homes. My administration is dedicating a lot of our resources to supporting the capacity of our healthcare system to handle a surge in positive cases and support Coloradans who are impacted in other ways. Now, I want to put in perspective what success looks like. There is no successful effort to contain this virus in the United States of America. It is here. I want to talk to you about the trajectories that can be affected based on the actions we're taking, which I alluded to the other day as well. This chart really shows, some of you have seen this sort of concept, but the contagion is here. People will get the virus. In fact, many Coloradans will get this virus, and for many, it will have mild or negligible symptoms. What we're concerned about now is that first trajectory, that red one, which is what we're seeing in Italy, which is where we don't have enough hospital beds, enough ventilators, where doctors and nurses are forced to triage and provide ventilators to those who have the best chance of survival. That's a horrific scenario that we do not want to occur in Colorado. That's why I was clear on Wednesday about suggesting that our vulnerable population not attend large gatherings, limit travel to the hot spots in the high country, because the public health care systems only have limited capacity. The second trajectory, the gray one, shows a scenario where we take the proper preventative measures of social distancing, as we are taking here in Colorado, which will ensure that our public health capacity is not overloaded. Again, many Coloradans and many Americans, under some projections, most Americans will likely get coronavirus. We're not going so far as the Chancellor of Germany, who said 50 to 70% of Germans will get coronavirus. We don't know, whether that's 10% or 60%, but many Coloradans will get it. You're going to get it, or a friend will get it, or a family member. Somebody you know is going to have coronavirus. They are very likely to have minor symptoms. They will have to remain isolated in their home. Our goal is to spread it out and protect the most vulnerable population, our seniors and those whose lives are at risk because of this virus, and that's what the steps we're taking are seeking to do. We all have a role to play on this, in flattening the curve and avoiding that first trajectory. I know it's a difficult time. It's a difficult time for parents whose kids are home from school because of cancellation. It's a difficult time for employers who are making additional flexibility around sick time or permitting work from home and accommodating families. This is a shared recognition that the public health consequences, the human consequences, need to remain our primary focus. This is how we're going to weather the storm, protect our most vulnerable, and prevent a catastrophic overload of the healthcare system and prevent deaths. First of all, we're doing all that we can, and we're advising people to take the proper precautions to avoid the spread of coronavirus. But even still, the number of infections are climbing and will likely continue to climb. Again, the attention on that daily confirmed rate of 59, we are testing more than any other state in the country. As I mentioned, over 10% of the tests given nationally have been given in Colorado, but that is just a small fraction of the likely positive cases in our state. Again, over 80% of the folks who get the virus recover on their own without need for hospitalization, without need for intensive treatment. What's critical is remaining isolated from those who are most at risk, your grandparents, your parents, your uncles, your aunts, and others who are immunocompromised. If you test positive for the virus, even if you're only exhibiting mild symptoms, it's critical to remain isolated to prevent the spread of the virus to others. You are a threat, especially to those vulnerable populations who make up about 20% of the severe cases. And if you're experiencing symptoms, it's critical that you quarantine yourself until you get a negative test result. You should respect the isolation and quarantine instructions of others as well. That's the only way we're going to avoid this red scenario here in Colorado. Now, even in Italy, grocery stores and pharmacies are open during the lockdown, but it's prudent to be prepared with extra food and supplies. We're also, again, trying to make sure that people avoid unnecessary trips out from our vulnerable population. That's why we're allowing people over age 65 to renew their driver's licenses online. It's also why our Department of Insurance has made allowances for seniors to get an extra month of prescription medications to avoid unnecessary trips to the pharmacy on an emergency basis. For those of you who have the means, please continue to donate to your local shelters and soup kitchens and food pantries, because we know that there are many families living paycheck to paycheck who can't afford extra supplies. We're all in this together, and we're going to get through this together. And I know that it can be difficult, it can seem surreal, but leadership means telling the truth and making the calls that are scientifically indicated to protect our health, the public safety, and the lives of our fellow Coloradans. If we were to take no action now, we would suffer worse consequences in the coming weeks and months. And it's critical that we prevent an overload of our health systems if we're going to avoid widespread devastation. And I want to mention again here, this overloading of our public health system doesn't just affect, in fact, its main effect may not even be the victims of coronavirus. When our public health system is overloaded, all of the other life-saving services that they provide are compromised. So it affects their ability to respond to other infectious diseases and even to heart attacks and strokes. So that's why this is so important. It's not just about, although it is about, the inability to address everybody with coronavirus, but it is also a capacity issue around all of the other life-saving services that are provided through our medical system every day and every week. And it's critical to round out that need to the best that we can. In additional emergency guidance today, I'm issuing guidance for the cancellation of large public gatherings of over 250 people unless they can successfully take steps to ensure a distance of 6 feet between parties. And that will be my message. I'm having calls later today with the faith community as well as with those who run venues. I hope that many of them develop contingencies for spacing, meaning they can have a group of 4 or 5 that attend and then 6 feet between the next group, otherwise temporarily shutting down gatherings of over 250 people. Frankly, even faith leaders of smaller congregations should recommend that they're most vulnerable, they're sick, they're elderly, should make alternative plans to attending in person those worship services if possible. And I know that that can be devastating. It can be devastating to trips, to celebrations, to graduations, to conferences, to social gatherings, to congregations, that we have to put many events on hold and postpone others. And I share that disappointment. But we are in the middle of one of the greatest international public health disasters of our lifetime, an internationally declared pandemic by the World Health Organization. And it's critical for us to take it seriously to protect our most vulnerable Coloradans and protect the ability of our state's healthcare system to treat them and others who need treatment. I want to take a moment to thank the members of our Colorado Press Corps, especially those who have been covering this story day in and day out. Again, this is a fine line, right? Of course, we want to promote awareness, but not panic. Awareness, but not panic. We want to be able to ensure that we don't exceed the capacity of our public health system, and we can do that through awareness and best practices and social distancing and reducing exposure. But again, many Coloradans will get coronavirus. Either you'll get it, a friend will get it, a family member will get it, and many of those will have minor symptoms and not require medical treatment. But we need to spread it out, and we need to make sure that our most vulnerable population are protected during this time. I want to thank the press for delivering accurate information in a timely manner, for reporting crucial information to your readers and viewers and listeners. That will save lives in the weeks and months ahead, and frankly, all of you should be proud of your work. It's times like this where we're reminded how essential a free press is in keeping the public informed and keeping the public safe, as well as, again, avoiding unnecessary panic and avoiding scams and those who would seek to profit on the misfortune of others. And we will continue to need your help and expertise in getting information out to as many people as possible, both to promote awareness and to avoid panic, two key goals during this challenging time. This is really an extraordinary moment, and it calls for extraordinary measures. The longer that other states and other cities and other countries hesitate, the greater the risk becomes. And dealing with this public health crisis needs to be our top focus. It really supersedes all other concerns. It's the responsibility of every Coloradan to do our part to limit the severity of this public health emergency. Following proper hygiene, respecting quarantine and isolation, providing paid sick leave to employees, making allowances to work from home. These are all incredibly important for our work. And again, Coloradans are resilient. We faced tough times before. We'll face tough times again, whether it's fires or floods or whatever the future will bring. But we're going to get through this together. We're going to come out the other side stronger. We hope to be an example in the nation of taking the steps that we need to minimize the impact on our vulnerable populations. But it's going to take all of us doing our part and doing right by one another to get through this. Again, that might mean that if you have a friend or neighbor in isolation, you don't shun them. You say, can I deliver groceries to your doorstep? Okay? It means that you have elderly members of your church that aren't able to attend. You want to make sure that they're given the documents, and you'll offer to bring home any materials from the pastor to them. Let's offer to be of help. Again, limit your exposure to our vulnerable population. Groceries left on doorsteps are a great example. And honoring those isolation orders if needed. Pending a test result, You can assume you have it, stay isolated, even though there's a 9 in 10 chance you don't, roughly, based on the information we have. There'll be more information in the days and weeks ahead. That's what we have now. We have Dr. Herlihy here to provide any additional information on the medical side. And with that, I'm happy to take a few questions. So we are supportive of areas that are acting quicker and with more information. For instance, Pitkin County went to a ban on 50 people or more yesterday. This is statewide at this point of 250. That fully recognizes that hotspots, and to be clear, while there is community contagion in Denver, it is not yet a hotspot. Pitkin County, if you look at the percentages, Eagle County, these are hotspots. We support localized efforts that might go further than the state order, but we do think it's important to have a state baseline in place, and based on the data that we have, 250 is a reasonable cutoff point. That doesn't mean that won't change, but that is the current guidance statewide. Again, fully supportive of that local flexibility for additional steps where needed. That was guidance before testing scaled. Now we have many private providers across the state, as well as the state facilities that are providing that testing. So that information was probably 4 or 5 days ago, where it was very difficult to get testing before LabCorp came online, before Quest came online. There was a very limited amount of testing that was only be provided to those that had direct exposure to others. Now we are recommending testing for anybody with flu-like symptoms. Again, in that context, also some patients. It doesn't mean you have to run out and get tested, but it means before making that decision about whether you can return to work when you feel better or whether you're going to remain isolated the full 14 days, you should get tested. What we want to avoid here is people who recover after 3 or 4 days not knowing whether they recovered from the coronavirus or a cold, and then return to work on that 4th or 5th day when they're likely to still be contagious. So I mentioned many of those providing testing today. The private sector is rapidly scaling up. I'm looking for that again, and I'll repeat it in just a moment as I answer Mary Ann's question. Mary Ann? So this has just been announced today. I'm encouraging those who now live here or who are here for an extended period and are licensed in other states to take advantage of this to get your ability to practice as a nurse, a pharmacist, or a doctor in Colorado under this emergency order. We won't know those numbers till we know how many people take advantage of that. This is just being announced today, and I want to encourage people to participate in that. Well, yeah, we certainly pushed the staff to the breaking point, and those were my instructions to Scott. We wanted to serve as many people as we can. They administered over 500 tests yesterday. They remained open about an hour longer than had previously scheduled. They were going to be reopening today, but they're not able to because of the snow. But we are providing additional capacity to them through temporary nurses, as well as through the National Guard, who have some people that are cross-trained as medics. What's your administration doing with this gathering ban? Are you going out to, say, the Pepsi Center, the Colorado Convention Center, and asking them to shut down events? Yes, I'm going to have the mayor address that. I also want to thank, somebody asked about the testing partners, UC Health, Children's, Centura, Kaiser Permanente, community health centers, many of them, but one we know for sure is Stride. Really anybody who has a relationship with LabCorp and Quest. Now, that doesn't mean every provider is doing it. Many of them are saying, we want you to go to a certain area where we're doing it because we don't want to mingle with the general population. But that has all been brought online in the last few days. In addition to the lab tour testing, 3 to 4 day turnaround. So you're going to remain isolated till you get that back, which roughly could overlap with subsiding of your symptoms. whether you have coronavirus, flu, or cold, we hope that you get better in 3 or 4 days, and that's the most common scenario. But then you will then know, I have to remain isolated all 14 days, or I can go back to work because it was just the cold. That's what's important from that perspective. I also want to applaud UC Health and Children's for working on developing the ability to process tests locally. That will come online at some point soon. What that will mean is 24-hour or so turnaround like we have from the state lab with our limited capacity on testing rather than waiting 3 to 4 days. So again, that will mean that people, if their symptoms subside, they test negative with the cold, they might be able to return to work a day or two sooner than not having that certainty with the 3 to 4 day turnaround in the state lab. Mayor, did you want to address the question around the venues?
Sure, we'll do our best. First of all, you know, Ed, great question. I want to just acknowledge very clearly that this is what leadership looks like, and I want to thank the governor for your leadership. Very substantive, forward-leaning leadership on this issue for all of us here in the state of Colorado. With regards to venues, this is an issue that my team has been discussing quite a bit over the week. We said at the very beginning of the week, this will be an evolving situation, and as more information becomes available and as guidelines from the CDC as well as from the state come available to us, we'll be able to make, I think, more definitive decisions. We were in very deep conversation with our culturals yesterday about what we are planning to do, wanting to do with regards to protecting all the patrons of these venues. Today, by noon or shortly thereafter, we're going to have more definitive guidance on venues such as the Convention Center, such as the Denver Center for the Performing Arts, where we will have a concentrated, where you have the potential for a concentrated number of people, 250 and above, coming together, as well as potentially the patrons who are 60 years and older in attendance. So we're going to give greater guidance. We're finishing up those now. We're giving greater discussion to libraries, to our rec centers, for example, also under the guidance, or excuse me, during the time in which our schools are being suspended starting next week. So there's a lot going on, but we're going to have greater guidance for those performing art complexes later on today. It's one of the considerations we have as well. We're in conversation with our district judges as well as our county court judges as well, how we might limit juries or the number of people being called. Those sort of things are under consideration. You can begin to understand as we enter into these conversations how it's not a straight line. There are a lot of questions and issues that have to be taken under consideration.
A lot of people are confused. We get a lot of emails from people who, they feel sick, they want to get tested. Is there a disconnect between doctors and leadership who don't really have straight answers for these people who are just simply confused and scared?
Yeah.
So again, some of that might date from a few days ago. Before LabCorp and Quest were able to do tests, there was essentially negligible testing capacity. That's why we had the state lab up and going, but that was only the highest prioritization of tests. A couple things have now occurred. Anybody can now send, anybody who has a relationship with LabCorp and Quest, and even if they didn't, they can set one up immediately. I've talked to the CEO of LabCorp. They can send out those samples, 3 to 4 day turnaround. In addition, we are helping with, again, the National Guard and others will be helping to be trained on the test collection. So that is rapidly scaling up. Does anybody else want to address that? You wanted to, Scott? Yeah.
Scott Bookman. Yeah, we're still getting test kits from the CDC. There are still limits on the amount of swabs available, reagent kits, so we're working with all of our partners to increase availability and increase the sites where we can actually collect the samples and then sending them out to our partners as well.
Let me also say, again, you don't need to be tested from a medical perspective. The value of the test is epidemiological, which we're doing. The second is, can I return to work after 3 or 4 days, or do I have to remain isolated for 14 days? That's the information, the actionable information that people need to know. Can I return to work when I'm well because it was a cold or flu, or do I, and then if you have a few days delay in getting that test, you just need to stay out of work and isolated for those extra days while you're getting it. But that is the value of that. If you are symptomatic and need to be hospitalized, that can be regular pneumonia or coronavirus or anything. You need to call 911, go through the screen, you need the care you're going to get. But for the vast majority of people, the value in that test, again, we need the statewide sampling, which we're getting. It's critical. The other value is, when can I return to work? So the 650 samples are not all run through the state lab. That's how many we assisted with collection of at the site at Lowry. Many of those are being sent to LabCorp, just as they would if they were collected at UC Health or Kaiser or somewhere else. There's nothing special about being collected at the state testing site other than that we have the limited capacity to process about 200 a day at the state lab. We are, again, prioritizing the most needed cases for that 200. The rest of a 3 to 4 day turnaround.
Governor, all this must certainly be having a tremendous impact on the state economy. Can you address that? And also maybe more specifically, your guidance to stay away from the high country if you're at risk, and what impact will this have on the speeding?
Yeah, and let me address, I think Jesse was about to ask that too, and I'll find my verbiage there. So first of all, our ski resorts are taking steps to ensure that skiing parties are not mixed with other skiing parties on a closed gondola. And additionally, as feasible, taking that step on chairlifts. What does that mean? And I believe this has already been implemented today or will be tomorrow. If you have a group of 4 or 5 people skiing, you're already exposed to one another, that group. You slept together and that you hang out together. We're not concerned about that. What we're concerned about is not being with other groups. And so the gondolas are being run in a way where your group will go up, however large that group is, and similar on a chairlift. You're skiing with 4 people, those 4 people will go up. There's no risk in that. That's already your group that's pre-formed. Outdoor recreation is a great thing to do during this time, right? Spacing from others, going hiking, going biking. If you're frustrated because your community center is closed with your kids, I know we are, what can you do? Again, today's probably not great with the snow, but generally with spring weather, hiking, outdoor recreation, all of those things are wonderful things to do with your family that are safe, that are healthy, and we encourage that in the coming days and weeks. So yeah, I mean, we have only begun to understand what those may be. It's our understanding that Congress, of course, worked on the public health emergency response last week. They are now working on the economic response. I encourage them. I talked to our delegation. I think it was yesterday, the day before, and I've talked to individual members even more recently. We are hopeful that there will be an economic package there. But no, there's the global economic impact. Again, you have to ask an economist that, not me. I don't know what that'll be. We're going to be as resilient as we can in Colorado by activating our workforce reserves and easing licensure requirements and encouraging students and others to be able to enter the workforce with the biggest focus on healthcare workers where we know we have the immediate surge and need. 2 more. So again, if you see what we're trying to avoid, it is that quick peak. We want to have a slow build. So we're hoping that there is cases are distributed over time in a more or less, it'll be a growing fat. There'll be more than there are now, but it'll be a plateau, not a, you can see what we're looking for here. So we hope to avoid an acute peak in the coming days is the goal of these social distancing measures.
Governor, you mentioned that people need to abide by these isolation orders. Have there been instances where people are not abiding by those isolation orders or the quarantine orders?
It's fair to say that while, again, we're sharing information with local law enforcement, we don't expect that local law enforcement will have the capability to enforce every isolation order. And that's why it's important, as we said, on your own. I know it's tiresome. I know it's difficult. But when you test positive or your test is pending, you do need to remain isolated for up to 14 days. If we can get that down to 10 or 12 based on the science, we will. But right now it's 14. And that's tough. And I get that. I hope that you can avail yourself of Comcast recently announced they're offering additional free internet. We're talking to them about other services that they can provide. Let me see what that information is here. It's Comcast is offering internet services to families who qualify for any kind of federal assistance through their Internet Essentials program. 60 days of service for free starting on Monday. And then we're working with them on trying to expand entertainment options for people who are under an isolation order. I mean, that's the main challenge, right? Why are people, you need to do the right thing, right? I mean, I get it. You might be bored out of your mind. You need to stay home. We're going to try to expand your entertainment options, everything else you need. but we have to protect our most vulnerable populations and slow this spread. And that's why that's so important. And again, that's the benefit of testing here, so you can get a definitive negative and you can return to your normal life after 3 or 4 or 5 days, right? After your symptoms subside, if you don't have coronavirus, you can return. And that's one of the key benefits of testing at this point. I was,
250 or more should not congregate. Does that include skiing and other outdoor?
again, generally in any outdoor activity, you're more than 6 feet, or your group is more than 6 feet from other groups. And I'll go to Alex in a minute here, but that's how this spacing works. It's not one individual and 6 feet another individual. It's the group that you're with, which could be 2 people or 6 people or 8 people, and then we want to recommend 6 feet between the next group. And so that's why, for instance, the ski industry has taken that step on gondolas. It means that public events can occur that have 1,000 people if they have that social distancing mechanism in place. Alex. Well, again, the testing capability of LabCorp and Quest is great. We have a number of collection sites across our state: UC Health, Children's, Centura, Kaiser, community health centers, including Stride, but many others. Really, most providers have a relationship with LabCorp and Quest. That doesn't mean that they all have the ability to take samples, because they want to make sure they have that precaution. But contact your provider. We will have, again, some ability at the state and at additional mobile sites. But the private sector is what scales this up. It is scaling up. And again, if you're unable to get a test right away, it means you need to isolate a little bit longer. That's what that means. It doesn't mean you need to panic. It doesn't mean you need to be upset. And again, if you're experiencing symptoms that require hospitalization, you need to make that contact no matter what. Again, it could be severe pneumonia unrelated to coronavirus. It could be coronavirus. If you need medical care, you will get the test. You will get the treatment. That's what we want to make sure of by avoiding this, right? I mean, these are going to be your regular everyday medical emergencies in addition to coronavirus that could exceed our capacity. So if you're unable to get the test right away, it just means you need to isolate until it comes back negative and treat your cold or flu like it might be coronavirus for that period of time. When you get the definitive negative and your symptoms subside, return to work. If you do have the coronavirus, you need to wait 14 days. That's a question for the NBA. We were not involved with that. Well, again, they were going to be operating today. They'll be operating tomorrow. We've served a lot. Yeah, the private sector is now available at more sites quicker. This was really to need a gap surge ability to test. There was a period of time 4 or 5 days ago where hardly anybody could get tested. That was terrible from both a health perspective as well as even figuring out our public policy response, because we were really shooting blind. We have a lot more information now. We're looking forward to, again, engaging the National Guard and the temporary nurses to further scale that, and I'll let Scott Bookman address that.
So obviously this is a big logistical challenge, and we're building it on the fly. And we're going to continue working with our partners. We're bringing in the National Guard. We're hiring contract staffing to do this, and we want to move it around the state so that we're providing this service to communities outside of the metro area as well.
Is there a sort of state plan to deal with underprivileged school kids who rely on school?
Yeah, so that was certainly first and foremost in our minds in our discussion with superintendents, and I'll be speaking with them again later today. They are, and again, this will be a question for a school district, but that was exactly what we posed to them. What are your plans to continue to deliver free and reduced lunch during this shutdown? They are making those contingency plans. Some of them had spring break anyway. That gives them a little bit more leeway. This is being viewed by the school districts at this point as expanding spring break, right? If there have to be additional or prolonged shutdowns, they're going to look at that distance learning component. Unlike higher ed, which is able to easier go to distance learning, many of them have made that decision. They're going to that. We support that decision in an abundance of caution. At this point, the K-12 closures are seen as extensions of spring break. If there have to be additional ones, they are all working on those contingencies as well for distance learning, as well as, of course, looking out for how the most vulnerable can remain fed.